Grzeskowiak. I'm a registered nurse. I just became a BSN, which means I am still a nurse, but I went to school for a long time to get that bachelor's part. And I'm also a certified emergency room nurse, and that's what I did for 17 years of my career. I was actually emergency trauma and critical care. And it's a big leap to go from that to talking about food. But the reality is your health is all about the food that you consume, all of it. It's extremely potent medicine, or it's a very slow, painful poison. Okay, so we're going to talk about today about how gluten, or that poison, for a lot of us actually affects your skin, because it does. And for those of you that don't know me or aren't familiar with my story, I actually had pneumonia in 2003 in January. Took Levaquin, which is a very potent fluoroquinolone antibiotic, and I quickly developed a systemic yeast infection. And over the next 4 years, my health plummeted. I continued to work in the emergency department with all my medical friends, and ended up with multi-system organ failure at the end of those 4 years. So I stepped out of the shower one day. Do I sign up for hospice? Do I just keep working? You know, really, what do I do? And my daughter was 10. So I went to see one of the only dermatologists I hadn't seen in Corvallis or New York, because I grew up in New York. And I went to see this doctor, and I was sitting on the table in my little gown, and it wasn't a very pretty picture at that point because I was about 45 pounds more than I weigh now. A lot of it was water weight. My hair was falling out, my eyes were bugging out of my head, I looked like Marty Feldman. I had chest pain all the time, my arms and legs were intermittently numb. And I am a knitter, but my doctors told me that I had numbness because I was a knitter. And I had to remind them I didn't knit with my feet. So I looked like I was between 3 and 9 months pregnant, depending on the hour of the day. Thank God for stretchy pants and scrubs. I had 4+ pitting edema, and all my lymph nodes were swollen. So I very nearly had a bilateral mastectomy, but these are still mine. And then I had that rash on top of everything. So, again, not a very pretty picture. So, Nurse Helen left the room, Dr. Haberman came in, and she said, I know what you have. It's really rare, and I've never diagnosed it before, but you have celiac disease and dermatitis herpetiformis. I said, that's really funny. I said, I've been a nurse for 16 years, I have no idea what you just said. And she said, well, you can't eat gluten anymore. I said, okay, what's gluten? She said, it's wheat, barley, rye, and oats. I said, okay, that's really funny too, because that's breakfast, lunch, and dinner. And then depending on how my shift goes in the emergency department, I might wash that all down with a beer or four. She said, well, you can't do that anymore. Okay, so they did a blood test and a skin biopsy, and I went off home, and I told my family I have a really rare disease, and I can't eat. There's nothing that I can eat. And so we went off on a trip to New York City, and I did the best I could at that time on a gluten-free diet. We came home, and I called up Dr. Haberman's office, and I said, Nurse Helen, what are my test results? And she said, well, your celiac panel is negative. You don't have celiac disease. And your skin biopsy is negative. You have a rash because you scratch your skin. Okay, pretty much confirming that I was crazy, and I made all this up. Which, by the way, had been implied before. I'm like, I'm really good, I'm a nurse and everything, but I can't make 4+ pitting edema and my lymph nodes swell. I can't do it. And why would I, really, honestly? So I was a little sobby about that. I was sitting at my dining room table, and you're like, I thought I had a disease, and now I don't. They took it away from me. And I don't have it. And my family said, you know what? We don't care what the test results show. You're clearly better on a gluten-free diet in 2 weeks. Why don't you just stay on it and see what happens? So I did. And within 4 months, I was so much better. I started my first business, which is RN On Call. It's a mobile nursing service. I do healthcare management for people, private nursing. And within another month, I was so horrified by what I found out about gluten intolerance and celiac disease, I started the Gluten-Free RN. My initial intent with that was to educate healthcare providers, my people that miss me. And what I quickly found out is they didn't want to know about gluten intolerance or celiac disease. And it took me a little while to figure that out. But number one, there's no pill for it. And I say this as a nurse, people get better. And we live in a for-profit healthcare society. Okay. So I have given over 1,000 lectures on gluten intolerance, celiac disease, and everything that it entails to autoimmune. I give 8-hour lectures on the mental health component of this and addiction issues, because it's all related. Okay. So the skin is just one part. Normally when I do this, I do a gut-brain-skin connection lecture, and if you had, I don't know if anybody ever heard that component. So today we're going to focus on skin, but believe it or not, it's all related. So we're going to go over an overview of basically, just like Anne did a little bit of gluten, what gluten sensitivity and celiac disease is, and then talk about the skin. The reality is, number one, I'm not dead, right? Obviously, I'm going to still do. 4 years, and to celebrate my 4 years of not being dead, I ran the Portland Marathon. And then I did it again just for fun, because it was so much fun the first time. I've run several half marathons, I've done the Hood to Coast, and next weekend I'll be climbing South Sisters. Okay. So obviously I'm much healthier now than I ever was, and I will tell you, I believe you can be much healthier also. Okay. The gluten-free diet is a good place to start, but it's not the place to stop. Okay. There's lots more to do. So celiac disease, it is considered to be a genetic disorder, but it's also environmental. It's the quality and the quantity of the wheat that we're exposed to from in utero, so that's in the womb, to however old you are. Okay. So in order to have a diagnosis of, proper diagnosis of celiac disease, you must be a DQ2, HLA DQ2 or DQ8 gene carrier, and have documented villus atrophy. Okay, it wasn't until a couple years later I found out, hey, I'm a HLA DQ2.5 homozygous gene carrier, which means I got a gene from my mother and my father, and I'm guaranteed to have celiac disease. Okay, that would have been a good thing for my parents to know before they started popping out children in 1950s and 60s, because my mother had at least 11 miscarriages, and the twins that were born prematurely 2 years prior to me died. Okay. This is a huge impact on fetal development and maternal health. Anne alluded to the infertility issue, and I think Dr. Tom O'Brien did also, but that's a huge issue. So we are trying to find women before they have children because this impacts. It is chronic, it never goes away. They used to tell children in the 1920s, 30s, 40s, and 50s that they would grow out of it. That's not true. A lot of those people that went back on a regular wheat-containing diet died. If they didn't, we're dealing with them now in their 60s, 70s, 80s, and sometimes 90s. And the medical sequelae is not always pretty. We can fix some things or stop disease processes just by going back on a gluten-free diet, but for a large part of the portion of these people, the damage is done and we can't fix it. It is autoimmune, which means that your body is attacking itself. It is not an allergy. That's an IgE-mediated antibody response. This is an IgA-mediated G-mediated antibody response. Different components, but all influenced. I never recommend that people get a food allergy testing until they've been on a gluten-free diet at the very least for 6 months to a year. Just don't do it. Okay, because you're going to be allergic to everything. Your immune system is on fire. This is primarily a neurological disorder. This is not a GI issue primarily. Unfortunately, it seems to have come under the auspices of the gastroenterologist, but primarily this is a neurological disorder. 28% of the people will present with some type of GI issue, digestive disorder, but 71 to 76% of the people will present with some type of neurological disorder. Sometimes that's their only symptom, such as migraine headaches, seizure disorders, neuropathies, ALS or MS are frequently misdiagnosed, dementia, all kinds of things. Learning disorders. Skin. So your skin is your largest organ. It does matter what you put on it. It literally takes 26 seconds from whatever you put on your skin to get into your bloodstream. Now imagine that you're putting mascara that has wheat germ oil in it, and I had no idea that mascara actually had wheat germ oil in it until I actually read the label. And I could not figure out why my eyes were always itchy and cracked and painful. And it's because of the wheat germ oil in the mascara. Now there are several mascaras that actually, and makeup and whatnot, that is wheat germ free, that is gluten free. And if you can imagine, number one, you're putting that mascara on right near what? Your eyeball, which is very close to a mucous membrane. So that 26 seconds is pretty much as soon as you put it on. It's in your bloodstream. And so we're sensitized to anything to do with wheat, barley, rye, and oats. Our bodies do not like them. Those proteins, okay? So please think about making sure, people will talk about actually having different areas of your kitchen, cleaning things and whatnot. When I went gluten-free, within a very short period of time, because I did not want to be paranoid in my own home, my entire house was gluten-free. Nobody brought it in, nobody cooked with it, the dogs ate gluten-free, and were, by the way, much healthier. I did not have to worry in my own home. Okay. Let's see. So the damage, and I'll go over this just in a few minutes, it leads to malabsorption of every nutrient. So if let's just say you have a low vitamin D level, that's an indicator of how low your A, D, and K are, which are also fat-soluble vitamins, but we do not test for them. So we only test for D. If your D is low, assume that everything else is low. And then it's multi-system. Because of the damage that occurs, and once those food particles are able to get into your bloodstream, including the long-chain amino acid protein, which is the gliadin protein, the hordein and the seclin is the barley and the rye, and then the avenine. Once those proteins are able to get into your bloodstream, they will wreak havoc on every organ in your body, including your brain. Because believe it or not, you don't just have a leaky gut. You have leaky blood vessels, a leaky blood-brain barrier, and leaky skin. Okay? Once you have a leaky blood-brain barrier, those proteins are certainly capable of crossing the blood-brain barrier into your brain, causing inflammation and hypoxia. Does anybody know what hypoxia is? Decreased oxygen flow. Now there's one thing your brain needs a lot of, that being oxygen. So here we have a situation where your brain is not able to get an adequate amount of oxygen, and at the very low end, that means you have brain fog. Okay, most people have brain fog. They don't know it until it's gone, but you've had brain fog. And then it goes, ADHD, can't focus, angry. So your brain's irritated. Some people are angry. Some people are anxious, bipolar, schizophrenia. It goes on and on and on. Okay, white matter lesions, calcium oxalate deposits in the back of your skull, or in the back of your brain, which is the cerebellar region. So that's celiac cerebellar ataxia. We used to think that was an issue with adults or older people. What we know now is that we have 2 children in the Pacific Northwest that have gluten ataxia. Okay? If there's 2 children in the Pacific Northwest, they're everywhere else. They just get misdiagnosed as something else. Okay? People are looking for it. Okay. We don't know what gluten intolerance is or non-celiac gluten sensitivity. We really don't. So if anybody tells you that they know exactly what this is, go thank you very much. We just don't know that much about it. And here's the other thing I'll tell you is that you can be ruled in for celiac disease, but you can't be ruled out. Not with our current testing. We currently have those HLA-DQ2 genes, which are the only 2 genes we're currently testing for. Europe is looking at least 39 other genes associated with celiac disease. Okay. This is healthy tissue on the top. This is your immune system. So I like to equate these these long finger-like projections, the villi. Again, that's healthy tissue on the top. That's Marsh 4 damage on the bottom. So we're going to equate these to soldiers because this is your immune system. So the soldiers on the top have had 8 hours of sleep. They've had their coffee in the morning. Their guns are shiny and loaded. They're clean. And the sky is blue. So when an antigen goes by, they go, T-cell looks over and goes, hey, Joe, do you want to get that or do you want me to get it? Because this is a T-cell mediated antibody response. But it's very easy, and your immune system works very effectively, and it takes out that antigen. Now what happens on the bottom? Those soldiers have been on a week-long bender. There's no coffee to be had. Okay? Their guns may or may not be loaded, and they're trying to operate in smoke and fire of inflammation. So an antigen or something else goes by, and they're like, I can't really see that. Can you see it? No. Should we shoot it? I don't know. So they do. And this is how people end up with multiple allergies that don't make any sense, because your immune system cannot function properly. Okay? So this is why I don't recommend that people get any of those allergy testings until they've been on a gluten-free diet and that inflammation is gone. Okay? What are the gluten grains? Just a reminder, wheat, barley, rye, and oats, and any derivative of any of those. So it's not just the gluten, it's not just the gliadin protein, it's any derivative. So people will say, well, can I have wheatgrass? No. Okay. It's either cross-contaminated, and let me just give you an example of why I'm so adamant that you don't have that. Is I sent somebody out to get some liquid multivitamin, and I say, get this brand because I know that it's safe, it's certified gluten-free, and it's really good. And usually I have people take a liquid multivitamin because it gets absorbed easier, never a tablet, because you poop those out. We can't break them down. And so the liquid. So I sent her to the store, and she said, well, they didn't have that one, but I got this other one. But ever since I started taking it, I've been having seizures. Like, stop taking it. I said, which one did you get? She said, well, it's labeled gluten-free. So I literally ran from my office to the store, and I picked up the bottle, and I looked at it, and the only difference was it had grass and barley grass in it. That gives my people seizures, okay? That's not good. So that's how much of a neurotoxin that potentially can be. So please pay attention to that. So any of the subfamilies of wheat, I had one lady tell me she'd been on a gluten-free diet for 18 months and she didn't need to come see me. She was doing fine as long as she had her spelt bread. Not on a gluten-free diet if you're eating spelt bread. Okay. So it's very important that you're educated and that you understand how wheat, and you'll see different names for wheat kind of getting really stuck in foods. So it's going to be very difficult to actually figure it out coming up. Because the wheat industry is not very happy that a third of the population is going on a gluten-free diet. So when I do talk about this, I make sure that you understand this is an economic issue, it's a social issue, it's a health issue, and it's also a political issue. What are the gluten-free grains? Nut flours are great on a paleo diet. They're fabulous. Also good fats. And I actually encourage and I tell people, if you're on a gluten-free diet, please do not be on a low-fat diet. There's nothing worse for you, and you will die. I'm sorry, but that's the truth, and you won't get better. The reason that is that they used to diagnose children with celiac disease in the 20s, 30s, 40s, and 50s with a fecal fat score, because they had steatorrhea, which means they had fatty stools. If you have fatty stools, it means you're not absorbing your fat. If you're not absorbing your fat, there's no hope of absorbing any fat-soluble vitamins such as A, D, E, and K. And if you're not absorbing those, guess what? You're not absorbing anything else either. Okay? So please, and I am on a super good high-fat diet. Okay, it's good for my brain because what is your brain? Fat. A bunch of neurons running through it. And you want that. You don't want your brain to shrink. And you don't want your nerves to demyelinate. And that's what happens in MS. Okay, it's autoimmune, the myelin goes away, the myelin sheath, but it's fat. So if your body wants to heal itself and you have hormonal issues or anything else, you actually need a super good cholesterol level. And not high, but you need a good cholesterol level. And what is high? Keep in mind that those lipid panels are all based on 50-year-old men. It might be a little different for women. And get a super good high-fat diet. I got off a little bit. So anyway, the grain flours, if you're going to eat flours, that's fine. Or whole grains, tough and quinoa are the most nutrient dense. Choose those more often than not. And use the darker ones, so the brown or the dark red, more than the white. Much more nutrient dense. Legume flours, people think that they're a little bit heavy and they have a bitter aftertaste, some people. I actually recommend that people avoid peanuts, for the most part, in toto. It's one of the #1 allergens. A lot of them are heavily genetically modified, and anytime they make school districts entirely peanut-free, it tells me that people's immune systems are wacky. And #1, if we're not going to fix the immune system, please avoid peanuts. Tuber flours, those are your main starches, and then seed flours, millet, buckwheat, and amaranth. And even though buckwheat says wheat in it, it's actually in the rhubarb family. As long as it's not cut with wheat flour, it should be fine. Where does gluten hide? Well, welcome to America. It's in just about everything. Last year, people, stamps and envelopes. Okay, last year we had 2 people in one of the support groups get sick. It was tracked back to, and the only thing that was different is they sent out Christmas cards. So they licked the envelopes. And those do actually not come labeled. Is it wheat paste or is it corn paste, right? Do your envelopes come labeled? Because mine don't. So I get the ones that pull off, or I use just tape for the spongy thing with the water in it, and then I wash my hands really well. Lipsticks and cosmetics. I'm very careful, and there are a number of product lines that actually are coming out with strictly gluten-free products, and I highly recommend that you use them. I'll show you some of the product lines that are available. Wheat is a cheap filler. It's in a lot of things, but more and more products are coming out that are wheat-free and gluten-free. Again, that Play-Doh, does it really matter if you get it on your skin? I had one of the emergency departments call me up that I used to work at, and they said, Nadine, we have a really weird question for you. Like, what is it? I love weird questions. And they said, well, we have a child here who was diagnosed with celiac disease, and they were playing with Play-Doh today at school. And now they're here because they've had 6 seizures. Is that possible? Oh, yeah. That's how much of a neurotoxin it is. Please understand that. This is not just a GI issue. And I don't care if they were playing with it topically, and they were just playing with it, or they forgot to wash their hands before they ate, or if they actually ate it, because kids will. Okay. Play-Doh is primarily wheat. Prescription medications, I have a great pharmacist in our town who actually checks everything, and he has little green stickers for all the prescription medicines that he verifies that are gluten-free, and he puts that little green sticker on that says gluten-free. I love him. His name is Tom. He's down in Corvallis, so I'm not giving him away. But all pharmacists should be doing that. If they don't, remind them of what their job is, or send them to me, and I will happily remind them. Because their job is to actually make sure that the medications you get are safe for you. I have one patient who got worked up for bone cancer, strictly because her numbers on her lab work changed so dramatically, strictly because they changed her Levaquin prescription from the brand name to the generic. That was all it took for her to look like she had bone cancer. Okay, so it's extremely important that you check your medications every time you get them refilled. What are the safe foods? And we do live in food utopia. Please, I don't want anybody from Oregon to tell me that there's nothing to eat, because this is not Oklahoma. I've been there, and there might not be enough to eat in Oklahoma, and they might live in a food desert depending on where you live, but we live in food utopia. Farmers markets, farm stands, you can grow your own. We have rain here. It's not even like California thing. It's really drying. I'm very concerned about California. So look to your local farmers for food, because they're going to be excellent sources of fresh fruits and vegetables, and then your grass-fed beef without any antibiotics or hormones. Okay, local. Your money stays local, it's all good. Plain meats and fish, we live an hour away from the ocean. How cool is that? Okay, so fresh seafood, rice and corn, 2 main starches. Potatoes, if you can choose sweet potatoes and yams over white potatoes, you're better off on several fronts. Number one, they're much more nutrient dense. They have a lower glycemic index for people that are diabetic or pre-diabetic, and then they're much more easy to digest, and they're not a nightshade. Dairy products are up there because most people that are celiac are gluten intolerant, or lactose intolerant at the very least, sometimes until those microvilli grow back, and most of us still cannot eat those proteins, because molecularly the gliadin protein and the casein protein are molecularly very similar, so our bodies read them the same. So I've had several examples of that. So when parents of autistic children come in and they say, I could never take my kid off gluten and dairy at the same time because that's all they eat. Mac and cheese, grilled cheese sandwiches, pizza, spaghetti with butter. They won't even eat, white food, right? Wheat and dairy, wheat and dairy, wheat and dairy. Like, yeah, because they have a morphine-like effect on their brain, both of them. So they're medicating themselves with their food, with a narcotic. Good idea? Probably not. And then the parents will say, okay, I'll do one, but I can't do both. So they'll take them off the gluten, and they'll come back in and they'll go, why is my child drinking 7 gallons of milk a week? Because they're compensating for the drug. Okay. So the gluten protein and the casein protein are molecularly very similar. That's why we typically will take people off of gluten and dairy at the same time, so they only have to detox once. Okay. Otherwise, we have to do it twice. And that is never really a good idea. You can do it, but I wish somebody would have told me that right up front. We have a lot of people that are misdiagnosed in this country. We know that. Celiac disease is the #1 misdiagnosed disease, autoimmune disease in America. Why? Where did it go for 70 years? Because it disappeared. We did know about it in 1950, and it quickly disappeared. There's a huge history, and I'm not going to go into that today. It did reappear in 1996. Thank you, Dr. Pisano. And for the next 10 years, from 2004, actually, NIH got together with a lot of the docs and the interested parties, and they said, hey, we should do a mass screening because we've been so negligent in this country for finding celiac. Did anybody get tested in 2004? How about 2008? How about last year? Didn't happen. They didn't do the mass screening. For the last 10 years, they've been looking for a non-dietary treatment plan for celiac disease. A pill. That won't work. So just so you know, and I highly recommend that people do get tested before they go gluten-free, but there will be a pill, and as soon as there's a pill, everybody will have celiac disease. But I want you to understand that that's what's happening. It will never work. They talk to each other like, okay, we're doing this, we're spending hundreds of billions of dollars to come up with a pill that'll never work. And they know that. But they're doing it just because. Just in case. Just in case what? I don't understand. Okay, so the blood testing, we know it's 70% false negative, but if you do get a blood test, which again, I highly recommend that you do, I want to see the entire panel. I don't want to just see pieces and parts of this. And I'd also like to see the anti-gliadin antibody component because that's an excellent biomarker of gluten sensitivity. It means your body doesn't like the gliadin protein. Okay? Most labs don't run it anymore because at least 50% of Americans will have a positive AGA. So why don't we run it? I don't know. They said it was too sensitive. Like, really? Okay. So, and as it's been mentioned several times over the last 2 days, the biopsy is no longer considered the gold standard for a number of reasons. Number one, it's not primarily a GI issue, but if you do have villus atrophy, it can be difficult to find, and most GI doctors only take 2 to 4 samples. The standard is at least 6, if not 15. Okay, most people do not have 15 biopsy samples taken. It is a genetic disorder. I do recommend that people with celiac disease in their family get the genetic testing. There's several labs that will do it. In TerraLab, you can order yourself. Most of these lab tests will be covered by insurance. If they don't, call me. I have a nice little journal article from the Journal of Insurance Medicine that says that as soon as people, the insurance industry spends less money, the sooner people get diagnosed. So chronic anemia and fatigue. My doctors, again, already always told me that I had anemia, chronic anemia, because I had red hair. It's not actually based in any science, but whatever. So you can begin to see fibromyalgia, chronic fatigue, migraine headaches. We used to call that in the emergency department if people came in with all 3, the trifecta, because they would hit all 3. We were completely mistreating these people, typically with narcotics, and so I feel real bad about that. But these people all should have been tested for celiac disease right off the bat. depression and irritability. If you know anybody that's mean, irritable, cranky, children here, please recommend that they get tested for celiac disease. That's my mother, by the way. I keep her 3,000 miles away. She lives in New York, I live here, and I try not to tell her I'm coming. She's just not a nice person. And that did actually impact how we grew up, by the way. So look around your neighborhoods, go to work, and find all those irritable, cranky people and say, you know what, I really think you should just get tested. Anybody with any thyroid disorders? Because for some reason that thyroid has a bullseye on it. If you have any thyroid disorder, I don't care what it is, Hashimoto's, Graves', hypo, Addison's disease, please get tested for celiac disease. For some reason, those glycoproteins will destroy your thyroid. If it's not ablated or taken out, you can typically undo the damage, and I don't care what that damage is, you can undo it. Okay, so we have a lot of Americans that are suddenly on a lot of thyroid medications. Maybe that shouldn't be the case. Again, I used to have Graves' disease. I don't have it anymore. Infertility, if you live in Finland, the number one thing they will test you for, whether you're a man or a woman and you have any issue with infertility, is celiac disease. It's currently estimated that 70% of Finnish people that have celiac disease are diagnosed. In this country, it's less than 1% of 1%. Any other estimate is a little bit overzealous. Any GI problem, again, that's from your mouth to your rectum, so dentists should be looking at for celiac disease in the form of dental enamel defects, canker sores. By the way, that's your skin. Bleeding gums is a vitamin K deficiency. Swallowing difficulties, that's neurological. Gastroparesis, GERD, constipation. By the way, constipation is a neurological disorder also. It's not a lack of fiber. Gas, bloating, irritability, ulcerative colitis. These are all skin issues, by the way. Same tissue epithelials. Diverticulitis, hemorrhoids, itchy butt. One lady came in, she goes, all I have is an itchy butt. It's my only symptom. She goes, if you can make that go away, I'll love you forever. Like, I'm not going to make it go away, you are. All it took was changing her diet. Okay, she doesn't have an itchy butt. Okay. But you have to ask what's irritating the bowel. You know, because we all say, well, I have irritable bowels syndrome. Find out what's irritating it. For most people, it is the wheat, it's the gluten, it's the dairy, it's something. And sometimes it's peanuts. Whatever is irritating your bowels, you need to remove that. Otherwise, you're going to continue to have IBS. Migraines, and people have heard of abdominal migraines or stomach migraines, right? Okay, so you have 95% of your serotonin is in your intestines, only 5% is in your brain. Okay, gut-brain connection, and because of the vagus nerve, your intestines, your vagus nerve actually goes from your brain to your GI tract. It's a ginormous nerve, and it provides all the innervation for your intestines. So gut-brain connection on the very, very basic level. And your guts can talk to your brain, your microbes in your guts can talk to your brain, but your brain does not have a lot of conversations with your guts or the gut microbia. It just doesn't happen. So what we're thinking is that this is your primary brain, your intestines. Okay. Psychiatric disorders, seizures, and skin rashes. Finally, sort of. So atypical, this is everybody else that doesn't have those GI issues. Neurological, cardiac. People with chronic coughs, I always hear people with chronic coughs, that just deep barking. They're probably exposed to gluten. I can always tell in the valley, I live down in Corvallis, when they're harvesting wheat, because there's a nice little article in the paper about increased trips to the emergency department for asthma. I'm like, oh, I know what that is. It's the airborne gluten. People are breathing it in and it's irritating. There's actually something called baker's asthma, that deeply affects the lungs, causes inflammation in the lungs, difficulty breathing, and a lot of these people are on asthma medications or steroid medications. Now, unfortunately, in my town, there's a bakery run by people with Down syndrome, which we know people with Down syndrome, Turner syndrome, and Williams syndrome are much more likely to have celiac disease, but they run a bakery. I mentioned that, but dermatologics, it's any skin rash, and we're going to talk about that. Urinary issues, kidney stones, difficulty urinating, incontinence. My friend Wendy Cohen, who is a nurse also, she worked in ICU at Meridian Park, and I worked down in the ER, and we didn't know each other until after we both figured out about the celiac disease component. So then we met, but she wrote a great book called The Better Bladder Book. It has to do with the urinary system and how gluten affects it and how food actually affects your urinary system. So kidney stones, repeat urinary tract infections, again, that's part of your immune system too. Interstitial cystitis is her specialty. Prostatitis, prostate cancer for men, and ED. Okay, if your brain's not getting oxygen, none of your other tissue is either. So ED being erectile dysfunction, Cialis and Viagra are not going to be very happy when all these men can just go on a gluten-free diet and function appropriately. Because it's a hypoxia, it's a perfusion issue. So skeletal, that's anybody with osteoporosis, osteopenia, osteomalacia, osteoarthritis, rickets. That's a vitamin D deficiency in childhood. It should be illegal in this country. I see it every day. In children and adults. That's the bowing of the legs because the bones were not strong enough to hold up the torso when the child was learning to walk. Once you have one autoimmune, which celiac disease is, your chance of developing another one is 30 to 50% greater. All these are autoimmune diseases. I had 7 of them. I no longer have them. I had a positive ANA, 2. I went on a paleo diet, and now they're negative. Doctors can't believe it. They're like, huh, what'd you do? I said, I changed my diet. And they're like, no, what else did you do? I'm like, I changed my diet. They're like, well, we're going to have to put you on Remicade. I'm like, no, my test is negative. So anyway, I don't have them anymore. You don't want these because these will kill you. So Raynaud's, I didn't have insulin-dependent diabetes, but I do find that a lot of people with insulin-dependent diabetes, there's a genetic overlap, so everybody should be tested for celiac disease, especially if you have type 1 diabetes, because the genetic overlap is ginormous. Okay? They test every type 1 diabetic child everywhere in the United States at every endocrinology center for celiac disease every year, again, because you can't be ruled out. And one test will not rule you out. And also because, the genetic overlap is so huge. But we don't test every type 1 diabetic adult. And then we call them brittle or we blame them for not being compliant. Okay. Then again, dental enamel defects, celiac disease should be looked for by every dentist in this country, but they don't. Michelle Piatzek, who's a pediatric gastroenterologist down in San Diego, will say, I can diagnose celiac disease with a smile. Because it shows up in your teeth. Again, fetal development. Canker sores, my mother always told us we had canker sores because we used swear words. Not true. And interestingly enough, if I do get gluten, the number one thing I notice right away within 10 minutes is I will get a canker sore. A blister in my mouth. Okay? And then I know, because I've had gluten, that I will have symptoms for 10 weeks. That's 2.5 months. All it takes is that breadcrumb to trigger an autoimmune response that will, for me, last 10.5 weeks, or 10 weeks. That's a long time, right? Okay. I won't tell you where the last time I got gluten was. Skin manifestations. Okay, here we go. So what is celiac disease? Typically, if you have DH, dermatitis herpetiformis, you are diagnosed with celiac disease. You have the same lesions in your intestine. But canker sores, mouth blisters, cold sores, those are viruses. Those are indicators that your immune system is not working, especially people that have multiple outbreaks. Okay? Warts is normally on there too. Again, that's a virus. If you have warts that won't go away, you have to look at the underlying cause of that and what is preventing your immune system from working appropriately. Dermatitis herpetiformis, if you have DH, if you have a diagnosis, then you have celiac disease. You must be on a gluten-free diet 100% lifelong. Unfortunately, I run into a lot of people who get put on dapsone, which, by the way, is very liver toxic. They get put on dapsone, but they don't get told they need to be on a gluten-free diet also. That's a problem. So the dapsone may or may not make those blisters or those lesions go away, but they're still eating gluten. So their intestines are still damaged. Everything else, a multi-system organ. I see a lot of people with acne. Is it really acne? Probably not. Okay, especially if it's not just on your face and it's not just hormonal. By the way, DH is actually influenced by hormones. So it's influenced by women's menstrual cycle. So we think we're getting acne breakouts, but it's perhaps not acne breakouts. It's also influenced by antibiotics. What do we give children with acne? Doxycycline, tetracycline, we give them that for years. What does that do to the microbiome that live in their intestines? It's a nightmare. Okay, so maybe it will take care of the acne, maybe not, but it is wiping out all of their normal flora in their intestines, making them at risk for all kinds of other things. Not a good thing. Psoriasis, which by the way is associated with RA, which is rheumatoid arthritis, which is also an autoimmune disease, which, believe it or not, is linked to celiac. Go figure. And itchy skin. We have a lot of people that just have itchy skin. I don't know why my skin's itchy, but it just is. I put stuff on and it's just itchy. That potentially is an indicator that you have celiac disease. My skin's just dry. Why? Vitiligo is an autoimmune disease also. Do you know what that is? It's a depigmentation of the skin. So white people have it, but you can see it more predominantly in Hispanic people, African Americans, Native Americans. It's a depigmentation of the skin. We can make that go away, strictly with a diet change. Eczema. What is eczema? That's like IBS. That's like telling somebody, most doctors are like, they don't like skin issues. They really don't. I had eczema my entire life. I got handed, I don't know how many bars of Dove soap and steroid creams. Steroid creams will thin your skin out, and actually steroids are contraindicated for people with celiac disease for a number of reasons. Just so you know that, I know some people have to be on steroids for a number of reasons, but please keep that in mind. And eczema, what is eczema? Eczema is frequently misdiagnosed celiac disease. Dermatitis herpetiformis is at least 25% of the patients with CD have some outbreak of DH. Again, it's an external expression of what's going on internally. Even if you don't have DH before you get diagnosed with celiac disease, frequently people will go on a gluten-free diet, and because it's an IgA deposit underneath your tissue, which makes it a deep tissue damage. Okay? It's organ damage. And it's deep tissue. It's not just on the surface of your skin. Those IgA deposits actually have to work themselves out. The rash is usually extremely itchy and can be very painful. Now, when I was covered pretty much over my torso and my arms and my legs and behind my knees, and I even had a couple chunks right here, which I had a special name for. I would step into the shower, and I would take 2 showers a day, which of course drove my dermatologist crazy. I would step into the shower. If nobody was home, I would scream. If people were not home, I would do the silent scream. It's extremely painful. It's very torturous. And as a nurse, I was very distraught that I could not self-diagnose this. And the reason I couldn't self-diagnose it, and I did read every dermatology book available to me, I found them, is misrepresented in every derm book I've ever read. Suspecting and then searching for dermatitis herpetiformis is often clinically challenging, as the disease is a true chameleon with many clinical faces. Do not assume that the lesion that you have, that you've always had, or that just appears or reappears in different funky places is whatever sometimes you're told it is. Okay, find somebody that actually knows about DH. Because this is what it feels like. For those of you who can't read it, it's like rolling in stinging nettles naked with a severe sunburn, then wrapping yourself in a wool blanket filled with ants and fleas. So I can assure you that people have actually killed themselves with this, and that there's documented cases, because there's no, unless somebody tells you to go on a gluten-free diet, there's no hope, right? Because nothing makes this better. Your skin is your largest organ, and please keep in mind that this comes from the American College of Gastroenterology. Gluten-containing cosmetics can be inadvertently obtained by the consumer, and the use of these products can result in an exacerbation of celiac disease. What does that mean? Yep, you have to check. Don't assume, and don't be exposed, because you will continue to have outbreaks, or you'll continue to be exposed to gluten. So I'm very careful. And I make sure that my people are very careful. Now this is a, can you read this? No. Don't worry about it. Doesn't really matter. I'm going to tell you a couple of these things. Hydrolyzed wheat, hydrolyzed vegetable protein. If you can't tell what it is, or they can't tell you what it is or where it was sourced from, please don't buy their products. And there's a lot of products out there that will say they're gluten-free. Some of them are, even within the same line. But then I got a couple shampoos from one company that said they're gluten-free, and I was very excited. And then I flipped one of them over, and I was standing in the shower. I used the one, I was like, oh, this is great. And then I flipped the other one over, because I always read the labels, and it says, hydrolyzed barley protein. Who even thinks of that? Who does that? Who puts barley in a shampoo? And so you will start to see different ways that, and this was one that was labeled gluten-free. Okay. So you can find them, they are out there. Petroleum oil is not necessarily safe for you. It's an oil, it will get absorbed on your skin. Please keep in mind, as a nurse, we know that we put topical medications on all the time. Nitroglycerin was something that we frequently would put on topically, and it worked very well, because it's absorbed through your skin. I've heard doctors say that your body is wrapped in something like saran wrap. Like, really? Mine's not. Plus, we have leaky skin. Okay? It's our largest organ. There's lots of personal care products. If you're not happy with the products that are out there, please develop your own. Green Beaver is a company that comes out of Canada. Canada has a lot of gluten-free products. They're much better at diagnosing people with celiac disease than we are in the United States, but their follow-up care is not all that great. So I spoke at Vancouver, BC, probably about a year and a half ago. Guess how many people showed up? It wasn't just to hear me speak, by the way. It was something similar to this. 30,000 people. Are they good at diagnosing? But not so much a follow-up, based on some of the questions I was asked. But Canada does have a fair number of gluten-free products. So if you're ever up in Canada, check that out. Again, traveling outside the United States don't be afraid of it, because they're typically much more better educated than we are. Monkey See, Monkey Do. It's a company that one of the moms, her child could not have anything on their skin because their immune system was so out of whack, which I find a lot with children. And so she developed this product. So if there's something that is not out there, develop it, market it, and sell it, and there's a good chance you'll become a millionaire, because this is the largest untapped market in the world. And I'm not kidding, that's why those doctors are looking for that pill. Okay? And they know that. They know that this is the largest untapped market in the world. I'm not kidding. So Desert Essence is a product line that is completely gluten-free and wheat-free. You can find it everywhere. They have it at Fred Meyer's, Market of Choice, Whole Foods. They have it everywhere. It's a safe product. Red Apple Lipstick is a cosmetic line that is completely gluten-free. Great lipstick. I think I have some on today. They also just came out with mascara, pencil liners, all that stuff. It's all gluten-free. There's other ones, Zuzu, that you can get at Natural Grocers. There's a number of them. Lovely Lady Products is out of Fort Collins, and they actually had me come in and do several of the talks on skin. But their product line is amazing, and I think they use helichrysum as their basis, and it is a very pure, and she's won amazing awards because of the purity of her product line. And they don't give me any money. I don't allow any companies to give me any money, because I don't want the information that I give you to be tainted in any way. So if I tell you I use a product line, I do, because I buy it. But please pay no attention to anything I'm saying. been starving for a long time, literally. Again, it's important that you're on a super good high-fat diet, and then when you do take your fat-soluble vitamins, that you take them with fat. So avocados, olive oil with your salad, bacon, that's like when I like to take my vitamins. And assume that if you are low in D, that you're low in all the other fat-soluble vitamins, which are A, E, and K. You can get calcium levels on your blood test, but nobody ever tests for magnesium levels. And when you do get that tested, because you're going to ask for it, ask for a magnesium RBC as opposed to a serum level. Most Americans are low, but they have no idea. It's not one that we actually test for in the emergency department routinely, but it is a drug on our code card, which means we give it for people that are actually in something that's called torsades, which is a cardiac issue, and eclampsia, for women that are pregnant and seizing. We give them magnesium. Wouldn't it be nice if we actually just gave them that before they were seizing? Just saying. So folic acid, we know that's very important for the neural system. Niacin, all your vitamin Bs. If anybody's familiar with Terry Walsh, she does a lot of work with dietary issues and treatment plans for people with MS. And her diet plan is very high in vitamin Bs, because most people, again, the docs will only test for B12. But if your B12 is low, guess what? Probably all your other Bs are low too, because we're starving, we're malnourished. It's important to be able to know that you can supplement. Most of us can't get enough of the nutrients out of the food, and we do have to supplement. This is huge business, as noted by upstairs and everything else. You're extremely powerful. Okay, do you feel powerful? Don't feel like a victim, because you're extremely powerful. You vote with your money, you tell people what you're going to buy with your money. You get your money local as much as possible. And so what I always tell people, because they say this is so hard, make it simple. Okay, when I go to the store, I stick around the outside, and I have a rule for buying products. And what the rule is that if there's an ingredient on the list, I have to be able to picture that ingredient, and I have to know where it came from. So I know what a cashew is, I know what a dried cranberry is, I know what lemon is, but I have no idea what hydrolyzed vegetable protein looks like, nor do I know where it comes from. And as soon as I look for one, and I see one of those ingredients and I have no idea what it looks like or where it comes from, I put that product right back on the shelf, because I have no time to call 1-800 numbers and try to explain to people what gluten is, right? Or why I'm concerned. That's a waste of my time. I want the companies to very, very clearly communicate to me what I need to know on those packages. So 5 ingredients or less, and I must be able to picture what those ingredients are. Now I will fudge on the 5 ingredients if it's something that I know, they're spices or something. But natural flavoring, not a clue. And the food industry actually has 6 months to change the labeling after they change the ingredients. So don't always trust those labels. So we spend a lot of money on healthcare. Spend a little bit more money on your food. Okay. Michael Pollan will say there's no such thing as cheap food. And I don't agree with everything that Michael Pollan says. He had pasta in the last book, so I don't like everything that he says. But I will completely agree that there's no such thing as cheap food. You will pay for it somewhere. Okay? So healthcare dollars, sickness, disability, decreased productivity, decreased earning potential. If you went to Dr. Tom O'Brien's talk earlier, you know that we just, as a community, do not attain as high education level or managerial level. We just don't attain as much because our brains are inflamed in our bodies and because we don't feel good. Okay? And so again, we now have evidence that the increased awareness and diagnosis of celiac disease could benefit not only the patients, but result in healthcare cost savings. Duh. Okay, other countries know, that's why they actively, especially in Italy, it takes 2 to 3 weeks to get diagnosed correctly with celiac disease. How long in the United States? 9 to 15 years if ever. A lot of people die without knowing that celiac disease is actually what kills them. Just on a side note, I'll put this in my book too. I'm encouraging people with celiac disease to actually, when they do die and have died of celiac disease in their obituary, to increase awareness. Okay. also would like the people that are dying suddenly of unknown causes, you know, the people that just drop dead, I want them tested for celiac disease on autopsy also. I'm working actually with the state and me to get that done. Wouldn't that be a good test to do? A nice little research study? So common myths, diarrhea is the most common symptom. It's not. Neurological issues are much more prevalent. Most people with celiac disease are actually overweight. They're not underweight. When I take my patients in to get them tested, you know, mostly they're elderly people. The doctors are like, why would I test them? They don't have chronic diarrhea, do they? I'm like, no, but they have a list of 15 other diagnoses that don't make any sense, and you have them on 30 medications. By the way, we're going to talk about that. And we're going to get them off of them. Okay? And this is a quality of life issue, so I never say, well, you know, my patient's 99, and can go ahead and do whatever he wants. I've had 99-year-old patients who've said, if this diet will help me feel better, I'll do it. So always make sure that people have the option, never deny them of the opportunity to feel better and have a higher quality of life. And please, 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 please do not be on a low-fat diet. Be on a super good, high-quality, higher fat diet. And if you think you're eating a varied diet, please do keep in mind that 8 to 10 corporations own everything in the grocery store. I'm not kidding. Even the gluten-free products, again, try to buy local as much as possible, know the people that are providing your food. And so these corporations are not doing R&D, which means they're not doing research and development. What they're doing is they're watching what's happening in the gluten, so I'm sure they're here. They come to conferences like this, and they'll see the products that are successful. And then they will swoop in, and they will buy them. And that's the exact second that I stop buying them. Because the standards will change, and I'm not giving any more of my money to these corporations, ever. Okay? So just be aware, you're extremely powerful. Okay? Our numbers will only grow, we're not going to go away. This is not a fad. So gluten-free services, this is what I do. I've given over 1,000 lectures all over the world. I do individual consultations. Insurances do not pay for me yet, but they will. We are trying to work to educate people globally about this issue, because you can feel better just changing your diet. Who knew? So when I posted this, and I put it on Facebook, and I did Twitter and everything, and people were laughing, and they putting funny comments, and then my daughter called me, and she breathed, and she said, no, she goes, Mom, that's you even have that green sweater. So, and if you ever come down to Corvallis, this is where my office is located, under the dark side. And I'm very comfortable there. But I do have the only office like it potentially in the country, maybe the world, because we have all the resources from around the world. We have all the research articles, and I vet them. I know who has done which study and who takes pharmaceutical money and who doesn't. So sometimes that taints the studies and the impact of that. So we have textbooks from around the world on celiac disease. There are no textbooks for celiac disease in the United States.